Lower back pain is one of the most misunderstood conditions out there. It's surrounded by fear, confusion, bad advice, and outdated beliefs. Whether you're hearing these things from social media, friends, or even well-meaning professionals, these myths might be holding back your recovery. So in this episode, I'm going to walk you through the 5 most common myths I hear from patients, explain why they are misleading, show you what the research really says, and give you practical takeaways to build confidence in your body again. Let's dive into it. Hey everyone, welcome back to the channel and to the second episode of our series on conquering low back pain. I'm Caleb Aseye, and if you missed episode 1, we explored why your back might hurt in the first place without diving into exercises. We broke down the drivers of pain, the anatomy of the spine, and what might be contributing to the discomfort you are feeling right now. Today, we are busting some myths. If your back hurts, you should rest. This is one of the oldest beliefs still floating around, that if your back is hurting, you should lie down, rest, and avoid moving as much as possible until the pain goes away. At face value, it sounds reasonable, right? If something hurts, you should stop using it so it can heal. That's what we do for sprained ankles or broken bone, so you should apply to back pain too, right? Not quite. The problem is, lower back pain isn't always about structural injury. In fact, most cases are classified as non-specific, which means there is no single tissue you can blame. It's more about sensitivity, load, movement, and how the nervous system is responding. When we rest for too long, especially in bed, we actually make the situation worse. Prolonged bed rest has been shown to lead to joint stiffness, loss of muscle strength, slower tissue healing, poor circulation, increased sensitivity to pain, more anxiety, and fear about movement. A major review published by the British Journal found that patients who were encouraged to stay active recovered quickly and had fewer complications than those who stayed in bed. Hagen et al. 2004. So what should you do? You don't need to go for a marathon, but light movements like walking, gentle stretching, posture changes can help improve blood flow, lubricate joints, and send signals to the nervous system that movement is okay. This is key to calming pain and restoring confidence. The key takeaway is that motion is lotion. Rest if needed for the first 24 to 48 hours, but after that, movement is medicine. If it hurts, something must be seriously damaged. This is one of the most emotionally charged myths. When we feel pain, especially if it's sharp, stubborn, or persistent, it's easy to assume something is badly damaged. Maybe a disc has slipped, maybe something tore, or maybe a nerve is being pinched. The fear sets in quickly, but here's what research tells us. Pain does not equal damage. Pain is not a direct reflection of tissue injury. It's an output from your brain based on perceived threat, context, belief, stress, past experiences, and actual inputs from the body. Let's break that down. If your body hurts after sitting all day or lifting something awkwardly, it's likely not because you slipped a disc or threw your back out. It's more likely a combination of sensitivity, fatigue, tissue overload, and protective tension. There are countless studies that show that structural changes in the spine, such as disc degeneration, bulges, and arthritis, are common in people with no pain at all. For example, Virginia et al. In 2015 reviewed over 30 studies and found that 80% of adults over 50 have disc degeneration, 60% have disc bulges, 20 to 50% have herniations, yet many of them don't have pain. So why do some people feel pain and others don't? Because pain is complex. It is influenced by your current stress and emotional state, how much sleep you have had, your beliefs about pain, how safe or threatening your brain feels, and your prior experiences with pain. The key takeaway is that pain is real, but it doesn't always mean damage. It's a signal that your body wants attention and not that you are broken. If movement hurts, I should avoid it. Another big one, and perhaps the most dangerous. If it hurts to bend, twist, or lift, the instinct is to stop doing these things. Maybe avoid them entirely. You might start bracing, tightening your core constantly, or moving like a robot. And while short-term protection can help reduce pain in a flare-up, long-term avoidance makes things worse. Here's why. your nervous system starts to label those movements as dangerous. So even when the tissue is healed or the original cause is gone, the brain still sounds the alarm when you move that way. Over time, the sensitivity goes up and your threshold for pain goes down. This is called central sensitization. If you stop bending because it hurts, you stop reinforcing the idea that bending is safe. The body forgets how to do it. The tissues decondition and movement becomes scarier. That cycle keeps you stuck. But when we reintroduce movement carefully, progressively, and with guidance, we build safety into the system again. You learn that bending forward doesn't break you, twisting is okay, and lifting can be safe when done with confidence and control. Vlaine and Linton's fear avoidance model shows us clearly that the more we fear pain, the more we avoid it, the more likely pain becomes chronic. The key takeaway is that pain with movement doesn't mean you are causing damage. It means the nervous system is on high alert and it needs rewiring through safe repeated exposure. I need an MRI or an X-ray to know what's wrong. This is a very common request I get from patients. Can we do a scan to see what's wrong? I get it. It's tempting. You want answers, something objective and something you can see. But here's the truth. In most cases of lower back pain, imaging doesn't change treatment and often does more harm than good. Unless you are showing signs of red flag like severe trauma, unexplained weight loss, numbness in your brain, or loss of bladder or bowel control, scans are not helpful. Why? Because most of what they show are normal. A study in the New England Journal of Medicine, Jensen et al. 1994, found that many people without pain had disc bulges, protrusions, and degeneration. These are part of the normal aging process, like wrinkles on the inside. When you see an MRI that says degeneration or disc bulge, it's easy to panic. You start to identify with the damage and you begin to think your spine is fragile. That fear changes how you move, how you feel, and how you heal. That's why guidelines from major organizations recommend avoiding routine imaging for lower back pain unless absolutely necessary. Chow et al. 2009. The key takeaway here is that you don't need a picture to start healing. You need movement, confidence, and education. Only surgery or injections will fix my back. This is often the last resort need. You've tried stretches, you've taken meds, and maybe you've done some physio, but the pain is still there. So the next step must be surgery, right? Not so fast. Less than 5% of back pain cases require surgery. The vast majority can be resolved or at least significantly improved through conservative treatment. Surgery is usually only considered if there's a structural compression causing neurologic loss like foot drop, failed conservative treatment for at least 6 to 12 weeks, spinal instability, or trauma. Even then, outcomes are mixed. Many people still experience pain post-op or develop issues at adjacent levels. Injections like epidurals or nerve blocks may help acute inflammatory cases, but they are not the cure. Their effect is often temporal. The best evidence we have for chronic non-specific low back pain points to graded exercise therapy, movement retraining, cognitive behavioral approaches, stress management, and lifestyle adjustments. A Cochrane review by Hayden et al. In 2005 concluded that exercise therapy significantly improves pain and function, especially when it is individualized. The key takeaway here is that you don't need something done to you, but rather you need to take active steps with the right support. Let's quickly recap these 5 myths we busted. The first myth was rest is best, but now we know the truth is gentle movement is better. The second myth was pain means damage, but the truth is pain is complex and not always structural. The third myth was if it hurts to move, stop moving, but the truth is safe movement helps calm the system. The fourth myth was you need a scan to know what's wrong, but the truth is most findings don't correlate with pain. The final myth was only surgery or injections will help, but now we know that rehab, movement, and mindset are powerful tools. You are not broken, your back is not fragile, and recovery is not only possible, it is expected with the right plan. In the next episode, We are going to explore the anatomy of your lower back, the discs, joints, muscles, nerves, and how understanding your body builds trust and accelerates healing. If you found value in this video, be sure to like, subscribe, drop a comment below sharing which myths resonated most with you. Remember, you are stronger than you think and your body wants to heal. See you in the next one.